Countries around the world are stepping up their anti-coronavirus measures to combat the Omicron variant. In Germany, the rollout of vaccines for children between 5 and 11 years old has been brought forward. Several nations have tightened travel restrictions as scientists work out just how much of an additional threat Omicron poses. In the UK, the rollout of booster jabs is being ramped up by the government. It's a similar situation in Germany, which has reported the highest number of deaths since February. The US is drawing up new travel guidelines that are likely to include having to test negative 1 day before traveling to the States. Japan and Hong Kong have said they will expand travel curbs. Japan recently reported its first case of Omicron. Many countries in Asia are now reassessing their COVID-19 measures. Our Southeast Asia correspondent Jonathan Head is following developments from Thailand's capital, Bangkok.
Fortress Australia was an extreme response to COVID, yet nearly all countries in Southeast Asia did adopt a version of it, effectively sealing themselves off from the rest of the world for around 18 months. Malaysia still isn't accepting any foreign visitors. Vietnam has only just started to open up a little with a few tour groups from Japan and Korea. And here in Thailand, where they've been struggling to revive the once massive tourist industry, they've been cautiously easing restrictions like mandatory quarantine just over the past 2 months. Now a new and highly infectious variant is spreading, confronting governments here with a dilemma. In tourist-dependent places like Phuket and Bali, businesses there are warning of dire economic consequences if leisure travel doesn't resume soon. And yet if there are severe new outbreaks under this Omicron variant, that could force governments to put their societies back into complete shutdowns and devastating the rest of their economies too. For the moment, most of the governments have responded by imposing bans only on some African and a few European countries where the new variant has already been detected. Only Japan has imposed a ban on all foreign arrivals. And yet, with public anxiety about COVID much higher in this region than, for example, in Europe or the United States, there is likely to be pressure on governments to impose even tighter restrictions. The good news is that vaccine rates across Southeast Asia are rising quickly. At nearly 90% of the population in Singapore, nearly 80% in Malaysia, and in Vietnam and Thailand, between 50 and 60%. Myanmar, of course, is an outlier. Vaccination rates there, with the near civil war that's going on, are below 20%, but then few tourists are likely to want to visit, even though the military junta there has talked about opening the country up. The worry is, though, that even with booster shots now beginning to be administered to patients here in Thailand, for example, that today's vaccines may not be effective against the new Omicron variant. And governments here cannot forget that even when they did cut themselves off from the rest of the world and seal their borders off at huge economic cost, while they kept the earlier COVID variants at bay for many months with very few cases, they all suffered severe outbreaks in the end during this year.
Jonathan Head there. Well, the World Health Organization, which held a special session in Geneva today, is to start work on an international accord on how to handle the next global pandemic. I'm joined now by Dr. Margaret Harris, spokesperson for the World Health Organization. Dr. Harris, thank you very much for joining us on the program. I mean, we are still learning so much about this Omicron variant, but according to the World Health Organization, it is one that should be of concern.
Yeah, good afternoon, Yalda. Indeed, the reason we put it on the variant of concern list was really because of the large number of mutations. It's got many more mutations than we've seen in previous ones, and a lot of them are in the spike area, and that's the area, the bit of the virus that it uses to enter our cells. And also because we were seeing the arrival of the Omicron with an increase in transmission in South Africa. So for those reasons, and really third reason, the fantastic science that gave us so much information from South Africa made it possible to immediately alert the world to this one as a variant of concern.
So in your view, Dr. Harris, how worried should we really be? And do you think the measures that many countries are now looking at putting in place is the right way forward?
It's a variant of concern. That means pay attention to it and do the things you need to do, step up your surveillance, do the public health measures. It's not a variant of panic. So the aim is to get the world alert, but not to get the world to overreact.
You're in Geneva at the moment, and there's this meeting about future pandemics and how to prevent it. Given our experience of the last 18 months, are you confident that going forward there will be measures, a global response that will be put in place to ensure that we don't get to the stage that we're at now?
I think there will be, because there has to be. We've seen throughout this pandemic that the scientists have been extraordinary, have worked together very, very well. That's why we're so far ahead with our vaccines, with our treatments. We've never seen anything like this in previous pandemics. And remember, this coronavirus family has been with us for thousands of years. We've never developed a vaccine before to it. So the scientists have been extraordinary, and the work together by the scientists have shown what we need to do and what we can do. Now, the other bit of the picture, the politics hasn't been so good. I think I'd give that, a fail. And that's where we need the pandemic treaty, or the pandemic agreement.
Yes, and you're right. We saw the science community globally come together to work towards, developing these vaccines. But in terms of the vaccine rollout and vaccine equity, that has been a huge problem. I mean, you yourself have travelled to some of the worst affected places. You were in Afghanistan. We were both there just last week. When you look at a country like that and how they tackle this pandemic, I mean, given all the other issues, how would you rate that?
So indeed, and Afghanistan's a very good example. They have only had access to 4 million vaccine doses. And do you know what? Even during all the conflict, all the strife, all of the things they've suffered, they have been able to get all those doses into arms. They got a big consignment of Johnson & Johnson just a couple of months ago, and the expiry date was very close. And they have managed to vaccinate people, refugees, health workers, even nomads out in Helmand province. I was just looking at the numbers, and if I hadn't been there and I hadn't seen what they were doing, I wouldn't have believed it.
And that includes a present day?
Present day, they are still continuing to vaccinate, but what they need, and what all other countries like Afghanistan, all the countries that are reliant on the rest of the world to support them and provide the doses, they need more vaccine doses. So this is where we have a real problem, in that the well-resourced countries are drowning in vaccines. They've got masses of vaccines, but we still are not getting nearly enough doses to the less resourced countries. The good news is that has changed in the last few weeks. We've seen a real acceleration in the amount of vaccine available through COVAX, but we also need to see technology transfers and intellectual property waivers to make it genuinely possible for countries that are less wealthy to make their own vaccines and get it into their own people's arms.
And are you seeing that, Dr. Harris? Are you seeing that will? Because we hear about these sorts of pledges and promises, but in terms of patents and giving these poorer nations or nations in crisis access, we haven't seen that, to your point.
We're certainly seeing a shift in thinking, but it is glacial. This is something right from the start, and I think you and I have had this conversation before, that this is something that needed to happen right from the start. We saw it with HIV. When generic retrovirals became available, the death rates in the poorest countries plummeted. It's nothing new, the need. It's not a new idea, but it is a behavior that the wealthy who own the technology are uncomfortable with.
Dr. Harris, always good to talk to you. Thank you so much for joining us.
It's a pleasure.